Anong naramdaman mo nun, Pasita?
Masakit. Kasi yung taong nangako sa'yo, umalis din. Pero tumayo ako sa sarili kong paa. Heto na ako ngayon. May sariling kumpanya.
Doc, ano po ba yung Sjogren's syndrome?
Oh, hi there. I heard you're asking about Sjogren's syndrome. Why don't you come with me? And I'll explain it to you. Let's go. A Sjogren's syndrome. Sjogren's syndrome, it occurs when white blood cells target healthy cells in moisture-producing glands such as salivary, sweat, and oil glands. So this condition most commonly affects women with autoimmune disorder. For example, lupus. There are two forms of Sjogren's syndrome. The first one is primary Sjogren's syndrome. It develops on its own, not because of any other health condition. Second one is the secondary Sjogren's syndrome. It develops in addition to other autoimmune diseases like rheumatoid arthritis, lupus, and psoriatic arthritis. So there are several factors that causes Sjogren's syndrome. First one, we have environmental factor, genetic factor, sex hormones that most commonly found with women rather than men, and viral infections. So these are the signs and symptoms of Sjogren's syndrome. First one, we have abnormal sense of taste, dry cough or hoarseness, dry itchy skin, fatigue, and for women, vaginal dryness. So how can we know if a person has Sjogren's syndrome? So there are several tests that we can use to diagnose a person. First one, we can take up their health history, run some blood and urine tests, biopsy of the lips, eye exam, imaging tests, specifically ultrasonography of the major salivary gland. So as of now, the Sjogren's syndrome has no cure, but there are several management to treat the effect of Sjogren's syndrome. We can use lubrication for the dry eyes. Next, we can drink plenty of water for dry mouth, and lastly, we can use moisturizer for dry skin. So now that we are done discussing Sjogren's syndrome, I'll further discuss salivary gland diseases such as xerostomia, sialolithiasis. Xerostomia is defined as dry mouth resulting from reduced or absent saliva flow. Xerostomia is not a disease, but it may be a symptom of various medical conditions, a side effect of irradiation to the head and neck, or a side effect of a wide variety of medications. So xerostomia is a common complaint found often among older adults. Xerostomia occur due to certain health conditions such as diabetes, stroke, and autoimmune diseases such as Sjogren's syndrome or HIV or AIDS. Eating, speaking, and swallowing disorders, sore throat, rough tongue, mouth sore, and mouth infections are the signs and symptoms of xerostomia. So to diagnose a patient with xerostomia, we have to review the medical history of the patient and the medication that the patient is taking. And we need blood tests, imaging scan of your salivary gland, or test that measures how much saliva you produce. And for the treatment, we can recommend products to moisturize your mouth or change medication that cause xerostomia or dry mouth. And for the next disease, we have sialolithiasis or salivary gland stone. is a benign, non-malignant condition involving the formation of stones within the ducts of major salivary glands of head and neck. This condition predominantly affect individuals 30 to 60 years old and is more often in males. It is caused by dehydration, Jargon syndrome, lupus, and autoimmune diseases in which the immune system may attack the salivary glands, gout, and smoking. The causes of sialolithiasis are swelling of the affected salivary glands, which normally occurs with meals, difficulty opening the mouth, difficulty swallowing, pain and swelling usually around the ear or under the jaw. And for diagnostic, we can take up the medical history of the patient and examine the head and neck, including the inside mouth. And for the treatment of sialolithiasis, the treatment depends on where the stone is and how large it is. For the small stone may push out of the ducts, and you may be able to facilitate this by drinking plenty of water or massaging and applying heat to the area. For the large stone, may be more difficult to remove and sometimes require surgery. Sometimes a thin tube called an endoscope can be inserted into the ducts.
Natunghayan na natin ang kwento ni Pasita at ni Carlo. Natutunan natin na gaano man tayong madapa sa buhay, ang importante ay natuto tayong tumayo at muling lumaban. Ito po si Charot Santo at ito ang